Hey, good morning. It's Dr. Pete. So I wanted to talk to you about fasting and kids. So what to do about that? First of all, I want to recognize that there's a problem. Okay, the problem is that children are so overweight and obese and sedentary anymore that the newest recommendation is to check cholesterol levels at the age of 10, which is insane. I can tell you that having worked in ICUs, it's very strange the frequency of people that we see that are coming in their 20s and 30s with stroke and MIs, heart attacks, among other problems, diabetes with DKA, extreme high sugars. So in other words, there's a lot of things that are occurring now at earlier ages that we never saw before. And the reason for that is people are starting to get sick metabolically at a very young age. There's just, the time of toxicity is just starting earlier and earlier, so that we see now people manifesting true disease earlier in life. Okay. So anyway, what to do? I think from a fasting standpoint, we at least can say teenagers don't have to eat anything after dinner. This is super simple. So what that basically means is, let's say they're eating their last meal before 6, they're waking up tomorrow at 6 or 7. That is like so perfectly normal in a healthy teenager. And in fact, we need to recognize too that we are creating healthy habits for them to live for life. Like, they might go through these nutritional stages and need to have food and whatever, but we're obviously getting it wrong in America. That's my point. So we need to value this time when they're young to develop healthy habits. And frequency of eating and when to stop eating is one of those things we need to hone in on. So teenagers, it's obvious. Don't eat anything after dinner, and if that occurs before 6 o'clock, perfect. And if they're not eating till the next morning, that's like 12, 13 hours. It's not enough really to move us into ketosis, but it's building a habit and a sense of freedom, and that's important. From the ages of 7 to teenager years, I think in general we can tell our kids not to snack in between meals. I think that's a win. I also think that, getting them away from a late dessert or a snack before they go to sleep is also a win. I have 4 kids. I used to stock up my child with chocolate chip cookie dough ice cream. Totally unnecessary. He was an absolute jug of juice, husky kid, and then he grew and he looked great. But point is that I don't think he would have died without chocolate chip cookie dough ice cream every night for many years. When you start going below 7, I have less clear advice. Okay, all I can say is that in general, we have a lot of kids that come into my emergency department that drink way too much milk and are anemic and eat way too much processed food and essentially are super constipated and can't move their bowels and live with nausea and belly pain chronically and need to have enemas and stool impaction and just disimpaction. And it's just like nothing that a child should be going through. So prior to 7, I would focus on the quality of food and getting rid of snacking. After 7, I would get rid of dessert. After teenage years, nothing after dinner, and let them fast per se until the morning after. And those are some good parameters. Once we're adults, 16 hours, easy peasy, and trying to get as close to that, as narrow of an eating window as possible for the rest of our good lives. Yeah, that's my recommendations.